I'm going to stand right here because I'm a little short, okay? I'd be remiss to say that my colleague, Dr. Noel Aikman, who was our program residency director at Jersey Shore, was to give this talk today. But unfortunately, we had an obstetric emergency with one of our colleagues, and as we do, we take care of our own. And so as I'm a soror of Delta Sigma Theta Sorority Incorporated, I am standing in for her. So this is her slide set, so, but I'm gonna do the presentation for her, okay? Okay, so this topic is going to talk about cardiovascular disease and how it affects minority women, which is Black women and women of color, and cardiac disease and pregnancy is the title. Okay, so maternal mortality. There are a lot of different causes of maternal mortality and pregnancy-related deaths, as you see on this diagram here. However, about 30% of them are due to cardiovascular disease. Okay, so we're talking about cardiac and coronary conditions, 13%, cardiomyopathy, 9%, and then hypertensive disorders, which is 7%, all right? More than 4 out of 5 pregnancy-related deaths are preventable. And of those, Black women are most likely to die from pregnancy-related causes from cardiovascular disease, 3 times more likely. So won't you let that sink in, 3 times more likely. So what is cardiovascular disease and how does it affect pregnancy? So even though it's less than 5% of complications of pregnancy, it is the leading cause of pregnancy-related deaths in the United States. And again, women of color are 3 times more likely to die of these diseases, okay? And these are rising due to increased maternal age. And I'm an example, I have my daughter at 40 years old. A lot of women are now more into professions first and deciding to get married and have children later. Prevalence of risk factors also include hypertension, obesity, and also diabetes, which are more prevalent in our race. So these are just some types of heart diseases in pregnancy. Hypertensive disorders is at the top. That includes chronic hypertension, gestational hypertension, which means that the patient got hypertension in pregnancy after about 5 months gestation. So we go by weeks in pregnancy, so that's about 20 weeks gestation or more if they get hypertension. And there's criteria that they have to meet to have that diagnosis. They can also have cardiomyopathies, meaning heart failure during the pregnancy, whether it's within the pregnancy or within 6 months or so after they deliver. It's called a peripartum cardiomyopathy. From a congenital heart disease, whether they had a repaired or unrepaired congenital heart defect as a child, and or born with it. Ischemic heart disease, where they had a heart attack, okay, which is called a myocardial infarction, the medical term for that. And that can be due to atherosclerosis from high cholesterol, okay? Dr. Roper is going to talk a lot more about that and numbers that can rule you in or out for atherosclerosis and increase your risk. And then we'll have arrhythmias. So these include atrial fibrillation as well as supraventricular tachycardia. So what are some other risk factors for cardiovascular disease in pregnancy? Again, we talked about the advanced maternal age. For us, for our specialty, 35 and above is considered advanced maternal age. Okay, obesity, irrespective of what class. Hypertension and diabetes, which I kind of touched on in an earlier slide. History of congenital or acquired heart disease. And then we have social determinants of health. Poverty, okay, access to health care, and then education level. All of these social determinants really can affect the cardiovascular disease in pregnancy and the outcome with the mother. So you need to know your numbers, women, ladies, okay? When you go to the doctor, make sure you ask, what is my blood pressure? They're going to tell you, but you need to not ask them, is this normal or not? And what are my risks if my blood pressure is a little bit elevated? Also, you need to have your screening done to check your cholesterol numbers, check to see if you are pre-gestation, at increased risk for diabetes. All of these things are called modifiable risk factors, okay? So this is the definition of hypertension in pregnancy, a blood pressure reading of 140/90. And again, as I said, if they have this blood pressure reading before 20 weeks of pregnancy, their diagnosis is chronic hypertension, meaning they had it before they were pregnant. If they develop it after 20 weeks gestation or after 5 months of pregnancy, it's considered gestational hypertension. And those patients concern us a little bit more because they're at risk to have something called preeclampsia, which I'm going to talk about in a later slide. But how do you protect your heart? Again, knowing your numbers, eating heart healthy, having more fresh foods, live foods and fresh fruits and vegetables, less salt foods and less fried foods. And then you can move more. Regular exercise, whether it's just a power walk, 20 to 30 minutes, 3 to 5 times a week. Doesn't have to be anything really strenuous. And then advocate for yourself. As I said before, when you go to your doctor, make sure you go with a list of questions. What does my blood pressure levels mean, and if it's high or not high or about to be high, let me know what that means. What are my risk factors for diabetes? Risk factors for high cholesterol, and how can we control that with diet and things like that. Again, these are modifiable risk factors. And so when patients present with symptoms and they have high blood pressure, this is also known as a silent killer. So people can walk on blood pressures at levels of 200s over 100s. Sometimes they feel fine. Sometimes they have a mild headache, okay? Sometimes they can have blurred vision, where they can have changes in their vision. They may attribute it to maybe I need glasses, or I wear glasses and I need to go see the eye doctor. Sometimes they'll have swelling in their hands and their legs and their feet after working or being up all day, or they can get pain in the vertebral quadrant of their abdomen. These are for our pregnant patients, okay? These are signs of something called preeclampsia. Patients who have preeclampsia, if they're term, meaning over 37 weeks gestation, the recommendation for them is delivery, because this can cause in-organ damage for the patients and increase their risk for death, okay? So, to take an action for your health, you want to stay informed and ask questions at your doctor's visits and advocate for yourself. You want to build a support system with your family and your friends and community groups. Go into things like this. Spread awareness to help other women stay healthy. I have an accountability group that we do with our exercises. We text each other every morning about the exercise that we did, what we had to eat today, things like that, just to help keep ourselves accountable. And then push for policy changes to improve Black maternal health, because it is a problem.
Cerebrovascular and cardiovascular health. I kind of link them together because what affects the brain also affects the heart. The risk factors for heart disease are the same risk factors for stroke. And so therefore I kind of link them together as cerebrovascular and cardiovascular health. Now we look at this, and when we look at our community, we must realize that we look at the metrics, and the metrics all end up with the life expectancy. Life expectancy in the United States by race, Asian Pacific Islanders have an average life expectancy of 85.7 years. Latino Americans, 82.2 years. Caucasian Americans, 78.9 years. And African Americans, 75.3 years. And finally, Native Americans and Native Alaskans, 73.1 years. So you see that there is a delta between, no pun intended, but there's a delta between the years in which the greatest life expectancy and the lowest life expectancy here. The delta is about 12 and a half years. And there's reasons for that. They're not just genetic. There are lifestyle reasons there, and these are things that can be changed in order to improve the metrics of one. Physiology and pathophysiology. So vascular health, it relates to the superhighway of arteries and veins, whose purpose is to transport oxygen and nutrients through the blood to the tissues and waste from the tissues to the kidneys in order for it to make urine and waste and come out of your body. A disruption in the flow due to endothelial hyperplasia, that's when your arteries and veins become thickened, and it disrupts the flow of blood. Sometimes there's platelet aggregation that can disrupt the flow, and also or blood loss through the vessel that causes tissue death due to deprivation. Tissue death in the heart is called a myocardial infarction or a heart attack. Tissue death in the brain is cerebral infarction or a stroke. When we look at the heart, It's a very intricate muscle with many branches that come off of it. We have, most people have heard of like the aorta, which is the major artery of the body. There's the aortic arch coming off of the left ventricle, which is the most powerful part of the heart muscle that pumps blood throughout the body. Blood comes through there, goes up to the brain, goes down below to the lower part of the aorta and delivers blood down to the lower organs. And so sometimes disruption in flow can occur even within the heart, and that's how one gets a heart attack. Different types of heart disease can occur. So not disruption in flow does not immediately lead to a heart attack. It can lead to several different diseases of the heart. And here are some of the conditions that can occur. Coronary artery disease and MI. That's blockage and flow of the heart vessels. CHF, that stands for congestive heart failure. Reduced strength and pumping ability, mainly of the left ventricle of the heart. Atrial fibrillation, which is an abnormal rhythm or one of the many types of arrhythmias that can be caused in the heart, in which the beating of the heart is abnormal from an ectopic foci. An aneurysm can occur. Weakness and bulging or herniation of an arterial wall. And many people have heard of people who have had aneurysms. And then dissection is when there's a splitting of the arterial wall where blood is supposed to come down the middle through what is called the intima, but it goes between two walls, the intima and the media, and therefore it's not really effective, and it's a very, very dangerous situation. So those are the major things that can occur with the heart. With the brain, I put up a diagram of brain circulation, and something that, you know, in medical school we all learned about what is called the circle of Willis. And this right here, many things can happen within the circulation here, but very similar to what occurs with the circulation of the heart. One can get blood vessel disease there, in which there's blockage, in which one can get a thromboembolic stroke, and that's a blockage. Very important. Time is muscle when a person is having a heart attack or a stroke. Time is muscle. And the longer one waits, then the greater the chance that whatever damage is done is going to be irreversible. There is a substance called TPA, which is used in the emergency rooms when a person is within 6 hours of a stroke. That's why if you feel like you're having a stroke, or someone thinks that you're having a stroke, it is important to get to the hospital as soon as possible. Because beyond 6 hours, you cannot get that medication. But that medication will reverse the stroke. So if a person has a paralytic arm because they lost blood flow to that part of the brain, if I had something in the left cerebral part of my brain, I would lose power on my right side. And if I had right hemiparesis, if I got to the hospital within 6 hours and it was determined that it was not a hemorrhagic stroke, then that medication can be given and reverse that, and I would have full use of my arm. A brain bleed or a bland stroke, they present the same way in the body. So when a person, that's why the person, I say you get to the emergency room within a certain amount of time, because before you can get the medication to reverse a bland stroke, they have to make sure you're not bleeding. Because if a person is bleeding and they get TPA, they're going to kill you. You're going to bleed to death if you get that. So that's why you just can't go in and say, hey, I heard that I could get this right here. No, you have to get a CAT scan and everything, make sure that it's not a bleeding stroke. So the risk factors, as I stated, risk factors for stroke and heart disease are the same. And so the risk factors or causes, there's hypertension, which is a cause, and we'll get into some of these in a little bit. Diabetes is another cause. Hypertension, what that is, hypertension is when the heart has to beat against a very intense pressure in order to deliver blood throughout the body. So the higher the pressure, so uncontrolled hypertension, the heart is beating against a great pressure. The heart is a muscle that beats 24 hours a day, 7 days a week, as long as you are alive. The heart never takes a rest. So if you have your heart beating against pressure that it should not be beating against, you're going to tire out your heart muscle. That's why it's very important to have your blood pressure controlled. So hypertension. A normal tensive person is a person who has blood pressure, a systolic, the top number, 120 or less, and the bottom number, which is called the diastolic number, is 80 or less. So the top number is when your heart is the pressure when your heart is beating, when it contracts in and it's pushing blood throughout your body. And the bottom number is when the heart is relaxed there. And elevated blood pressure, you see these numbers here, they're stage 1, stage 2, and then emergent hypertension. Diabetes, impaired metabolism of glucose leading to hyperglycemia and an elevated hemoglobin A1C. You see what the numbers are. What this does, uncontrolled diabetes, when the sugar is high, it releases certain mediators which causes thickening of the arteries, and so that's a risk factor for stroke and heart attack as well. Hyperlipidemia, this is the cholesterol. And you want to keep your total cholesterol under 200, triglycerides under 150. The good cholesterol is, the good cholesterol is the HDL cholesterol. You want that over 50. And that right there, what the good cholesterol does, it removes fat from the blood. These other ones, they cause blockages in the blood vessels, which can lead to heart attack and stroke. In addition to causing the blockage just from the high cholesterol there, it also causes what is called intimal thickening. The lining of the artery gets thicker, and so therefore it impedes the flow of blood, and the person can get a heart attack. Lastly, the allostatic load. This is the collective physiologic and psychologic weight of chronic stress. It is determined that the allostatic load in African Americans is pretty much the highest. And it is things such as home life, and it's more of a socio-economic factor. These are things that are the allostatic load. One quick way to know what that is, some of you may have heard of Gil Scott-Heron from back in the 60s and 70s, The Revolution Will Not Be Televised, Marvin Gaye's What's Going On, Stevie Wonder, Living Just Enough for the City. These are things, if you listen to the lyrics of these songs, then you know that that right there is what the allostatic load is. We have treatment, there's lifestyle changes, physician guidance. I want to focus on real quick. Do not take internet advice as gospel. There's tons of purposeful misinformation there. And in conclusion, you want to minimize your risk factors, take advice from trusted PCP, medical professionals. That's who you should take your advice from. Avoid anecdotal social media advice. Just because your girlfriend may have said, hey, this right here has worked for me, it's off-label, doesn't mean it will work well for you. And guess what? When it doesn't work well, you know what? There's nothing you can do about it because you had no business taking advice from a non-medical professional. If medication is needed to control your high blood pressure, high cholesterol, diabetes, take as directed. Mental health guidance to assist in the navigation of the allostatic load. And just remember, I am here to keep you here. Namaste and live well.
My name is Chesney Blue. I am from East Orange, New Jersey, registered dietitian. Most of my background is in the clinical and community nutrition space. I've worked at a lot of different hospitals in northern New Jersey. I've worked with a lot of doctors in their clinics with one-on-one nutrition counseling. So I have a good variety of experiences in the nutrition, food, and healthcare space too. So today I'm going to talk about heart health, 5 simple steps to living a heart-healthy life. And a lot of the information is something that are tips that the previous doctors mentioned earlier, so I'm glad they really did a great explanation of, disease pathophysiology and pathology, so, and some lifestyle information. But I'm gonna go and focus more on nutrition, and I'll try to be quick too, because I know everyone's probably trying to get home and maybe even stop by all the tables before they leave, so I'll be real succinct, y'all. I know how to stick to definitely gonna stick to the minutes here. All right. So just some facts about heart disease in the Black community. Black adults are 40% more likely to have hypertension. Black women are 60% more likely to have hypertension compared to white women. An interesting fact that I came across recently was that Black women aged 20 and up, 58% of them have hypertension. That is a very high statistic that we want to help with reducing that as well as help with treating that as well. Heart disease kills 50,000 Black women annually. 49% of Black women have cardiovascular disease, and 68 of people aged 65 and older die from cardiovascular disease with diabetes. And here are some risk factors that have been mentioned before. They're usually all the same in regards to cardiovascular disease, as well as stroke, hypertension, high cholesterol, cigarette smoking, which is a big one. A lot of people don't realize it, even though there's lots of public health policies in place to help with reduce cigarette smoking, it's still very common, especially with the increase of e-cigarettes and things like that. Also, diabetes, obesity, and social determinants of health, which was mentioned as well. So I won't go too much into that. All right, so know your numbers. I'm the know your numbers person too. I know the other two doctors mentioned that as well, but you want to know your blood pressure and your blood sugar, hemoglobin A1C, blood lipid levels, and BMI. That's a little bit something different than what was mentioned, but BMI, I know the BMI chart is not the most accurate, especially for people of color, and that's not the only number that we look at as clinicians, but it does help. It is a tool that we utilize in regards to health risk and issues that may come up. So we know that the BMI isn't the best measure for weight and height for a lot of people, especially from what the chart is based on, but it's still some type of tool that we utilize, but it's not the end all be all. We don't heavily, well, I don't anyway as a clinician, heavily I don't focus that much on it. I focus on some lifestyle changes. All right, so get into 5 simple steps to living a heart healthy life. All right, first, you want to choose food low in salt. The goal is 2,400 milligrams of salt daily. That's what the American Heart Association promotes. Now, I know it's on here, but did you know that 2,400 milligrams is 1 teaspoon? That's really it. And that's in regards to added salt, like adding your salt to your meals. It could be a variety of different things. And a lot of foods that we eat already have sodium in it, because sodium is also used as a preservative for foods to sit on the shelves longer. So you want to look at that food label. I have a handout on how to read a food label that you can try look at for your reference. But you want to try to reduce your salt intake as much as possible by not adding a lot of salt to your meals, using more different herbs and spices and things like that to help with flavoring your meals. So choose other alternatives, or like your pepper, lemon, onion powder, basil, garlic powder, ginger. Those are also some good things that you can utilize instead of salt, in place of salt. You want to choose foods rich in potassium, magnesium, and calcium. That helps balance things out and helps with reducing your blood pressure. So foods, if you see a pattern, you see it's all healthy foods, right? Fruits, vegetables, low-fat dairy you want to have too. So adding that into like every meal, one of those nutrients, potassium, magnesium, and calcium, that can help with controlling your blood pressure. And also a rule of thumb that I always suggest, because I used to work at a dialysis center too, so that's something that we always have to know about sodium and potassium levels, as well as phosphorus levels too. But for recommendations in regards to sodium, if you're looking at the food label, if it's a side dish, it should be less than 300 milligrams of sodium. And for like the goal for like your frozen dinners. I know some people who here eats frozen dinners sometimes. They're quick and easy, yeah. A few people did raise their hands, yeah. So frozen dinners, even the Healthy Choice, the Lean Cuisines, the Marie Calendar frozen dinners. You want to look for a frozen dinner that has about less than 550 milligrams or less, basically. Sometimes, you know, I would sometimes say go up to, depending on what your blood pressure is and your kidney health is, you could go up to maybe 600 milligrams, but it should be under that, close to 500 as much as possible. The brands that usually have the low salt is your Healthy Choice and Lean Cuisines are the good ones with the lower amounts of sodium. So some other information, like I said, lower your salt intake, decrease alcohol intake too, and try to do more physical activity as well. Physical activity, as was mentioned, it helps with just good oxygen and blood flow, and it helps with reducing, it helps with improving your cardiovascular health, basically. Keeps you moving, it keeps you active, it keeps you flexible, and it just overall brings more nutrition and, like I said, oxygen into your body so that, you know, you're living a healthier life. So that helps with reducing your blood pressure too. All right, number 2, reduce your added sugar intake. All right, any diabetics in the room or anyone that has high blood sugars, you're probably told maybe you're pre-diabetic or something like that. This is something that can be helpful for just about everyone by reducing your sugar intake too. And when I mean sugar intake, I'm talking about added sugar. That stuff, not the sugar that you see in fruit. A lot of people I come across, they always stop eating fruit because someone told them they shouldn't have a lot of sugar in their diets. No, that's not the sugar we're talking about. We're talking about the added sugar that you see as sugar sweetened beverages, cakes, cookies, pies, all that stuff. So you want to reduce your intake of that and try some different alternatives to help with reducing your sugar. And I have some alternatives up here. Usually a lot of people get a lot of sugar through what they drink, such as sodas and things like that. So you want to choose some low-calorie drinks such as water, low-fat milk, or milk alternatives such as soy, almond milk, vegetable juice. But if you have kidney issues or hypertension, you want to just look at the sodium content of that too. A lot of vegetable juices do have low sodium options. Coconut water, unsweetened tea, infused water you can also utilize to keep yourself hydrated. And I'll also give some suggestions of high water content produce such as your carrots, pears, grapes, watermelon, greens are high content foods that you can eat more of to help with your hydration status. All right, and then I just have a slide on type 2 diabetes, which is what we want to try to prevent or help with treating and controlling. So you want to make sure you choose more complex carbohydrates, which are your high fiber foods. You want to increase your plant-based foods, so that's your fruits and vegetables. How many people get 3 servings of vegetables a day? Oh, that's a good amount. All right, good. We got half the room getting your 3 servings and half not, so that's something to work on. All right, pretty good, pretty good. And if you are in a larger body and you're looking to possibly reduce your weight because of different reasons to help with controlling blood sugars, to help with joint pain and things like that, you want to make sure that you try to lose at least 5% of your weight. Helps with, improved outcomes. Thank you. I got 5 minutes, y'all. All right, so I'll go through these quick. All right, so you want to make sure you know about add more fiber, rich foods into your diet, as I mentioned before, and as well as I want to try to do and fats too. So I'm going to go through the fiber. I'm not going to go too much into it. All right, so when looking at the food label, you want to look at the, see how much fiber is in a particular food item. 3 grams or more is what you want to look for. Something super high in fiber would be 5 grams or more per serving. So that's a good rule of thumb for yourself when looking at high fiber snacks, protein bars, things like that, that you may be eating, okay? Fiber just helps with improving your cholesterol levels. It pushes out that bad fat, keeps you fuller longer, and it keeps you regular too. So that's always good. So I'm like, yeah, exactly. It does. It also helps with regulating your blood sugars too. So if you are someone with elevated blood sugars, most dietitians will always say, increase your fiber intake basically, because that will help with reducing, lowering your blood sugar numbers. Ways to add fiber into your diet: increase vegetables to meals, increase fruit to meals, snack on things like berries. Berries are a very high fiber fruit. So blackberries, blueberries, raspberries are the high fiber foods, fruit. Snack on seeds, popcorn, nuts, and choose whole grains as healthy sides, such as brown rice, quinoa, whole wheat bread, and barley. All right, fats, just a quick overview. I know in the Black culture, we like to have a lot of coconut oil. Coconut oil, I'm not going to say not to have it, but eat it in moderation, okay? It is a saturated fat, however, it's a plant source, so it does have some nutrients in it, and it helps with reducing inflammation, but still you want to consume that in moderation. And I know a lot of recipes in our culture sometimes ask for a lot of coconut oil. So choose oils such as avocado, canola, olive oil, sesame, or peanut oil for your cooking needs. And this is just some the types of fats that you want to try to avoid: saturated trans fat, and consume more of the mono and polyunsaturated fats too. All right, number 4, bring more meals back home. How many, if anyone wants to shout out, how many times a week do you eat out? You go to a restaurant. No one wants to share? Someone said 5. Someone gave me 5. That's good. 4. All right, 20, 30 years ago, we didn't do that, honestly. We were probably eating out once a week 20, 30 years ago. But now that food has gotten a little bit cheaper for some people, or it's just more convenient because we're so busy doing all the things, doing lots of things basically. So helping with that is to just think about, try to cook more meals at home, do some meal planning, meal prepping, throughout the weekend or whatever day you have available during the week, where you can sit and plan out some of your meals. Start off with 1 to 3 meals a week to try to plan out, and then go food shopping to pick up the food items or get them delivered. A lot of people get their food delivered now. So try to bring more food home, because fast food restaurants, their content is high, the serving sizes are bigger than what you would normally have at home too. So that increases your intake of like high salty foods, high fatty foods, as well as just the portion sizes are bigger too. So try to bring more meals back home to help with reducing your grocery bills. Look at the circulars, see what's on sale, and choose produce that are in season. When the produce are in season, it's usually always much cheaper. So you want to do that. Try frozen fruits and vegetables too, or frozen foods that don't have a lot of sodium or sugar added to them. Try those as well. All right, so I'm sure a lot of people are familiar with this plate. I have it over on my table too for illustration. But how many people's plate looks like this at home when you eat? Or even tonight, did it look like that? All right, so the goal is to try to get it back to this plate too as well. And what you see is the difference, I'm sure, with a lot of people is half the plate is filled with vegetables. That's an easy way to think about it. Half your plate should be filled with vegetables. Hopefully some high fiber vegetables, but half your plate filled with vegetables. A quarter is your carbohydrate, and a quarter is some lean protein or some type of protein rich food, okay? So that's, the plate method, an easy way to eat well without having to count calories. So this is always a good tool to have. So, and then also another lifestyle thing, number 5, is move. Do some type of exercise. If you can walk. 20 minutes, 3 days a week, start off with. That's it. Where there's an increased sedentary lifestyle in the country, so we want to make sure that you're active as much as possible. But walking is an easy physical activity that you can do. And if you are, you really want to push it, you want to add some strength training into your daily regimen too, as well, by light weights and things like that if you can. Okay, so. Get that exercise in. The recommended amount is 150 minutes a week. Broken down, that could be 30 to 60 minutes per day, depending on what your schedule is. So that's it. Oh, let me do the summary. So just some quick pointers, meal plan, reduce your eating out, increase intake of fiber. If you remember anything, increase your intake of fiber and watch your portion sizes. Start with that and you'll be good to go, as well as stay hydrated too.
And we're going to start the question and answer. So if you have a question, raise your hand. Jennifer out there will have the mic. She will give it to you so you can stand up and ask your question. Just let us know who the question is for. We have a question over here, Jennifer.
Hi, this is for Dr. Roper, correct? You mentioned in your subject of hypertension, how, and I'm summarizing how the heart works harder with the increased pressure. Can you explain more of what pressure is internally?
Okay, so hypertension is the pressure in which, as I stated, which the heart beats against, and when we measure it in two folds. One is called systole. That is when the heart is contracting and working hard. And the other one is diastole. That's when the heart is relatively at rest. And the heart beats between 60 to 100 beats per minute in people with a normal heart rate. The healthier one is, the lower the resting heart rate. So with that right there, so if the systolic number is very high, such as 200, which is a hypertensive emergency, that means the heart has to push against that 200 millimeters of mercury. That's how we measure it. It has to push against that in order to deliver the blood throughout the body. So the heart is a muscle, and so imagine if a muscle, if you have to keep lifting, you're lifting weights. If you're lifting something that's light, you can do that a lot longer than if you're lifting something that's heavy. So the increased pressure is the heart trying to lift something heavy there, and therefore it would cause the heart to fatigue. The heart muscle will get weaker, and that will cause what is called cardiomyopathy, in which the heart cannot beat properly. It doesn't necessarily just stop. There are some people that go into sudden cardiac death, which is asystole, when the heart just flatlines. But thank God that doesn't generally happen. Usually there are warning signs. The person will go into congestive heart failure from, so uncontrolled high blood pressure will lead to congestive heart failure, because the heart becomes weaker and weaker because it gets too tired of beating against such a high pressure. And so that's pretty much hypertension 101.
Any other questions?
I have a question. Long down. Great, thank you so much. Hi, thank you. This was so wonderful, and I appreciate you all being here and sharing this wonderful, incredible knowledge. Dr. Roker, you hear there are times where you hear something about a mini stroke or TIA. What happens there? Why is it just a mini stroke and people just get better?
So mini stroke, or TIA, stands for transient ischemic attack. That means transient means short-lived, and ischemia means a block of flow. And so therefore, it's a short-lived block of flow of blood to a certain area of the brain. So the brain is called, I used to do a lot of neurology, it's called the homunculus. And in that, each part of the brain, it would be better if I had a diagram, but each part of the brain controls a different part of the body. So, and when you have what I showed, a picture of what is called the circle of Willis, the circulation of the brain, is that if there's a blockage that is transient, short-lived, a blockage to the ophthalmic artery, a person can get temporary blindness, or if there's a blockage to my right cerebellum, I might temporarily get paralysis of my left hand, and it can come back and everything. So that's what a TIA is. That means that there was a temporary blockage. So something blocked it. There may have been what is called vasospasm. That's where smoking comes in. For those who smoke, and I'm not trying to get religious on you, but those who choose to smoke, whether it be cigarettes or weed, you can make your own decision. But there's something called vasospasm. So when you put toxins in the blood, such as high nitrogen levels that comes from tobacco and nicotine and tar, it causes vasospasm. So the blood vessel is like a garden hose. And when we were younger, all of us have probably taken the garden hose and you squeeze it and less water comes out. And then when your brother or sister comes out, you let it go and get them. So a transient ischemic attack is when a temporary squeezing on that and blood does not get to that part and the person gets paralysis, blindness, aphasic, which is loss of speech, and swallowing problems. And then it releases and then the blood flows again and then that goes away. So that's what a TIA is, or a mini stroke. A regular stroke is when that squeezing doesn't go away. So a TIA is your warning sign. One of the things I did not get to say up there, and again, this is general information, speak to your doctor about it. That's why a baby aspirin a day is generally good. If you have a bleeding disorder, and I have no idea whether any of you do, you may not take that right there. You might have an ulcer, you may have already had a bleed somewhere, but because sometimes that TIA is caused by what is called platelet aggregation. That means too many platelets. Platelets is one of the substances made in one's bone marrow, and if too many platelets are there, it can cause blockages, and aspirin is an antiplatelet medication, so that can help prevent TIAs or major strokes, so to speak.
Thank you. One more question, Chesney. Thank you for sharing your wonderful presentation. I love what you did. You concentrated mostly on portion control, balance, moderation. You didn't go into any abstaining from certain food groups. You see lots of diets out there, omit all carbohydrates or omit all dairy, yada yada yada, and so forth. What is your opinion on these so-called? We used to call them fad diets. Now they're just internet diets.
With fad diets, I'm not into them in regards to like maybe fasting, intermittent fasting, or keto and things like that. That's something I would never really promote as much because all foods fit in a good balanced diet, basically. It's all about portion control, moderation. I don't want to take away a lot of people's cultural foods because when you restrict, 9 times out of 10 in my practice, people will tend to overeat later, even if they're fasting. When they get off their fast, they start eating a whole bunch of carbohydrates. I have someone in my family like that now. They fast or they do the Atkins diet, and they don't eat a lot of carbohydrates. So then when they're off of it, when they met their goal weight, right, they just go and just overeat basically after that fact. And then it's like a cycle. And it continues to cycle, which causes more work for your heart to function well when you're in that diet cycle. That's why a lot of people who binge or might even be anorexic, they're at a higher risk of cardiovascular disease, and that's how they actually pass away too, because they're working their organs so much with how they're eating with restriction and things like that. So you don't want to continue to do that. All foods fit, working with a nutrition professional, registered dietitian to help you create a plan and to add your favorite foods into your diet without overdoing it or without restricting. That's always very helpful diet-wise. I'm always about, let's try to do this and that instead of restricting. You want to ask yourself, what can you add to your diet to make it better? That's really a better way to think about how.
Thank you.
One more question.
I want to add to just a little anecdotal story in regards to lifestyle. Definitely agree with the lifestyle and with the GLP-1s. There still is a diet that you have to follow when you're on that medication, basically. A lot of people need to know that. Everyone thinks diet is a 4-letter word, but as a dietitian, I see diet as just the pattern of how you eat. That's the literal definition of a diet, really. Now, when we talk about fad diets or restricted diets, that's a whole different thing. But you still have to follow some type of diet for it to be sustainable, whether you're on a medication or you're not, honestly. So there's lots of, symptoms and issues with the medication if you're taking it too. In regards to lifestyle, I will tell you this story. My grandmother lived to 92 years old, and she was a heavy smoker in most of her adult life. She stopped smoking when she got diagnosed with COPD, maybe like 25, 30 years before she passed away. And she lived just from stop smoking. She's quick cold turkey and lived to 92 years old. Plus she was in a larger body like myself. But the key thing is she stopped smoking and she walked everywhere. She took the bus a lot, public transportation a lot. So she walked a lot. And those lifestyle changes, those lifestyle things that she did helped her to live a good full life at 92 years old. So lifestyle changes really do work. Small little steps can go a long way.
Good evening, everyone. My question is, I guess, a two-part question. The first, is it true or false that there are certain high blood pressure medications that are not good necessarily for African Americans? And if that is true, other than Googling and doing all those things, how do you really know which ones you maybe should not be taking? And I'm sure it's customized by person, but are there some general guidelines?
I would say talk to your physician, and again, it goes to advocating for yourself and letting them know that, because of my race or background, from reading, you definitely do Google or Indeed, things like that, but make sure you review with your physician. And that keeps them on their toes and helps them stay honest about things that work better in certain races of people. So I would approach it like that.
I will add, is that, yes, there are certain medications that seem to work a little bit better in one race versus another, because even though the human race, we're more identical than we are different, but there are, if you really look at the minutia, that there are minor differences in us. So there's a medication, there are medications called, in a class called ACE inhibitors. ACE stands for angiotensin converting enzyme inhibitor. And in our body, there's an RAS system created in the brain, goes down to the adrenal glands and things like that. And Caucasian people have high renin hypertension. Renin is created in the adrenal glands above the kidneys. And when you have high renin, an ACE inhibitor works because it blocks that. And so therefore the vasoconstriction or the closing down of your artery, it allows it to open when you use that ACE inhibitor. African Americans tend to have high volume hypertension therefore in an African American, sometimes I will start with a water pill or another medication called amlodipine, which I've had a lot of success in the 25 years of practice of using amlodipine in African Americans, whereas my Caucasian patients, I might have them on a medication called enalapril. Now, some African Americans in here may be on enalapril or captopril, lisinopril. They don't make captopril. I'm telling my age, and that was back in pharmacy school. See, it always takes a doctor to catch a doctor. Our anesthesiologist, they're catching me out there with my age. But yeah, lisinopril, so those, many African Americans will be on that. So if you're African American, you're on that. Don't sit there and think, oh, don't go to your doctor and say, Dr. Roper told me that. I did not say that. There's a reason for that. So ACE inhibitors are protective when you have diabetes. Diabetes causes a certain type of kidney disease, and you want to lower that. So even though you may naturally have a lower renin level, you want to lower it even more if you have hypertension and diabetes. So there's a reason why I do put some African Americans on ACE inhibitors, but generally as first line, that's not something first line that I would use in an African American because usually it's usually volume related, and an ACE inhibitor is not going to address that, and so therefore so yes, there are. But as Dr. Massey stated, definitely speak to your physician, because there are some cases where that could be used more than a water pill or a calcium channel blocker or a beta blocker and things like that. But there are minor differences, and so definitely make sure you go to a doctor who's going to listen to you, who you trust, and not just not what you might hear on the internet. And I'm glad you said you could Google it. Google is a good reference point, but then you'll get a whole bunch of other things that may not be true.
Thank you for answering any questions. And once we finish, if you want to come up here and ask more questions individually, but we kind of wrap up the evening.